Hello there, my name is Dr. Loh Huey Wen, and I'm one of the consultant obstetricians and gynecologists from Sunway Specialist Centre, Damansara. January is Cervical Cancer Awareness Month, and we hope that today we can share some facts about cervical cancer and what we can do to prevent it. So what is cervical cancer? Cervical cancer is actually cancer of the neck of the uterus here. So this is the opening to the uterus, and this is known as the cervix, and this is cervical cancer. So how common is cervical cancer? Cervical cancer is quite common. It is the fourth most common cancer in women around the world. What are the symptoms of cervical cancer? Cervical cancer usually tends to present late, and cervical cancer can present in a multitude of ways. It can present as abnormal bleeding, which can happen after sex. It can happen sometimes after your menopause as well. There can be a change in your vaginal discharge. So the vaginal discharge might change in smell, it might change in color. There may be pain as well during sex, and all these symptoms should prompt you to go and visit your gynecologist to make sure that everything is in working order down below. What causes cervical cancer? 90% of cervical cancers are caused by the human papilloma virus, also known as HPV. Now, there are about 100 different strains of HPV out there, but we do know that some of the strains can cause cancer. And this HPV can be transmitted through sexual contact or through skin-to-skin contact. Now, the problem with HPV is that HPV tends to be asymptomatic, so you won't know that you've got an infection with HPV. It is always wise for you to seek medical attention should you develop any symptoms. Who is more likely to get cervical cancer? Cervical cancer tends to happen in younger women. So women under the age of 45 are at higher risk. Women who have a weakened immune system, either through medication or through diseases such as diabetes or HIV, are at a higher risk of cervical cancers. If you've had multiple children, particularly at a very young age, particularly teenage pregnancies, then you are at an increased risk of cervical cancers. And if you've had a previous history of vaginal, vulval, or bladder cancer, then your risk of cervical cancer is also increased. How do we prevent cervical cancer? So cervical cancers can be prevented by doing regular cervical smears. So what happens in a pap smear is that we put an instrument in, have a look at the cervix here. We take a sample of the cells and we make sure and have a look and see if there are any changes to the cells. Sometimes we can detect changes which can be precancerous. Treatment of these precancerous cells will actually prevent you developing cervical cancers. So it is important for you to keep up to date with your cervical smears. The use of condoms and safe sex obviously will prevent HPV infections, so that is recommended if you have a new sexual partner. Smoking tends to weaken the immune system, so if you're a smoker, smoking cessation will actually reduce the risk of cervical cancers. And lastly, the HPV vaccine will actually protect you against the cancer-causing strains of HPV and thus reduce your risk of cervical cancers as well. So what is the HPV vaccine? As we know, the HPV virus has got about 100 different strains. Of the 100 different strains, we know there are certain strains that actually cause cancer. The HPV vaccine protects you against 9 different strains of this HPV, which will reduce your risk of getting cervical cancer. Now, although this protects you against 90% of cervical cancers, there's still 10% of cervical cancers where the causes are not known. This means that you should still be up to date with your cervical smears, although you've had your HPV vaccine. So January is Cervical Cancer Awareness Month. Let's eliminate cervical cancer together.